ADHD, attention deficit/hyperactivity disorder. It's a mouthful, isn't it? And it represents a serious public health concern. Many people think of a disruptive child when they hear ADHD, but it's so much more than that. ADHD is a neurodevelopmental disorder. This means it affects the brain's development and how it functions. The core symptoms are inattention, hyperactivity, and impulsivity. These symptoms can manifest in different ways, creating a wide spectrum of experiences. Imagine a child struggling to focus in a classroom, their mind buzzing with thoughts, unable to sit still. Or picture an adult, overwhelmed by deadlines, constantly shifting between tasks, their mind racing. The impact of ADHD extends beyond the individual. It touches families, schools, and workplaces. Untreated, ADHD can have lifelong consequences. It can lead to academic struggles, relationship problems, and difficulty holding down a job. But here's the good news: ADHD is treatable. With proper diagnosis and support, individuals with ADHD can thrive. Recognizing ADHD as a significant public health issue is the first step towards creating a more informed and supportive environment. ADHD is not one-size-fits-all. It presents in different ways, making diagnosis tricky. There are three main types: inattentive, hyperactive, impulsive, and combined. In the inattentive type, difficulty focusing takes center stage. Imagine someone easily distracted, struggling to follow instructions, and frequently losing things. This type is often overlooked, especially in girls and women, as it might not manifest as outward restlessness. The hyperactive impulsive type is characterized by, hyperactivity and impulsivity. Think of a child constantly on the move, fidgeting, talking excessively, and interrupting others. This type is often more readily identified in childhood. The combined type, as the name suggests, presents with a mix of both inattentive and hyperactive impulsive symptoms. This blend can lead to significant challenges in academic, social, and occupational settings. Understanding these different presentations is crucial for accurate diagnosis and effective treatment. It's not just about being hyper or distractible. It's about recognizing the specific ways ADHD affects an individual's life. Diagnosing ADHD is like solving a puzzle with missing pieces. There's no single test, making it a clinical diagnosis based on a comprehensive evaluation. Clinicians rely on gathering information from multiple sources, including patient interviews, behavioral observations, and sometimes psychological testing. Adding to the complexity, ADHD often coexists with other conditions like anxiety or learning disabilities. These overlapping symptoms can mask ADHD, making it even harder to identify. Adults face unique challenges in receiving an ADHD diagnosis. Many struggle for years, unaware that their struggles stem from a treatable condition. They may have learned to compensate for their symptoms, making them less obvious to others. This diagnostic maze underscores the need for greater awareness and understanding of ADHD. Early identification and intervention are crucial for improving outcomes and supporting individuals with ADHD to reach their full potential. A concerning reality within the realm of ADHD is the presence of racial and sex disparities in diagnosis and treatment. Studies have shown that Black and Hispanic individuals are less likely to be diagnosed with ADHD compared to their white counterparts, even when presenting similar symptoms. This disparity is especially alarming when considering the potential for misdiagnosis. Black and Hispanic individuals are more likely to be diagnosed with conduct disorder, often a misinterpretation of underlying ADHD symptoms. The reasons behind these disparities are complex and multifaceted. Socioeconomic factors, cultural biases, and limited access to healthcare all contribute to this inequity. For example, implicit bias among healthcare providers might lead to differing interpretations of behavior based on race. The underdiagnosis of ADHD in girls and women further compounds this issue. Traditional diagnostic criteria often focus on external hyperactivity, which may be less prevalent in girls who tend to internalize their symptoms. Addressing these disparities requires a multifaceted approach. increasing awareness among healthcare providers about cultural biases, improving access to culturally competent mental health services, and promoting early identification strategies tailored to diverse populations are crucial steps toward equitable care. Section 5. The subtly powerful, unraveling mild ADHD. When we think of ADHD, we often picture its more overt manifestations: the fidgeting, the impulsivity, the constant chatter. However, ADHD exists on a spectrum, and at the milder end it can be easily overlooked. Mild ADHD, while not fitting the classic image, can still significantly impact an individual's life. The symptoms, though subtler, can create challenges in academic performance, work productivity, and relationships. One of the hallmarks of mild ADHD is its context-dependent nature. A person with mild ADHD might function well in structured environments, but struggle with disorganization and procrastination when demands increase or in less structured settings. This variability in symptom presentation makes diagnosis more challenging. Individuals with mild ADHD might not recognize their struggles as stemming from a neurodevelopmental condition, attributing them to personality traits or lack of willpower. Early identification and intervention are just as vital for mild ADHD as for other subtypes. With appropriate support, individuals with mild ADHD can develop coping mechanisms and strategies to manage their symptoms effectively, unlocking their full potential. Section 6. Entangled challenges, ADHD and comorbid conditions. ADHD rarely travels alone. It frequently coexists with other mental health conditions, creating a complex interplay of symptoms. These co-occurring conditions, known as comorbidities, add another layer of complexity to ADHD diagnosis and treatment. Anxiety disorders, depression, and learning disabilities are among the most common companions of ADHD. Imagine the added burden of navigating social situations with social anxiety, while also grappling with inattention or impulsivity. The presence of comorbid conditions can significantly impact the course and severity of ADHD. For example, untreated anxiety can exacerbate ADHD symptoms, leading to a vicious cycle. Recognizing and addressing comorbid conditions is crucial for effective ADHD management. Treatment plans need to be tailored to the individual's unique needs, considering the interplay of all present conditions. This integrated approach ensures that individuals with ADHD receive comprehensive care that addresses both their ADHD symptoms and any co-occurring mental health concerns. Section 7. A pandemic's grip, COVID-19, and the heightened struggle with ADHD. The COVID-19 pandemic has been a crucible, testing the resilience of individuals and systems globally. For those with ADHD, the pandemic's disruptions to routines, social isolation, and increased uncertainty have presented unique challenges. Imagine a student with ADHD trying to focus on online learning while surrounded by distractions at home, or an adult with ADHD struggling to maintain productivity amidst job insecurity and childcare demands. The pandemic's impact has been particularly pronounced for individuals with ADHD who rely heavily on structure and routine. The sudden shift to remote work and learning, coupled with social restrictions, disrupted established coping mechanisms, leading to heightened symptoms. The pandemic has also exacerbated existing inequalities in healthcare access, further marginalizing those with ADHD who rely on consistent support and treatment. Addressing the pandemic's impact on individuals with ADHD requires a multi-pronged approach. Telehealth services, online support groups, and resources tailored to navigating the unique challenges of ADHD during times of crisis are crucial for bridging the gap in care. Section 8. Beyond bias. Embracing cultural sensitivity in ADHD diagnosis. The process of diagnosing ADHD is not immune to the influences of cultural background and societal biases. Recognizing and mitigating these influences is paramount for ensuring equitable and accurate diagnoses across diverse populations. Cultural norms shape our understanding of behavior. What might be perceived as inattention or hyperactivity in one culture could be considered typical childhood behavior in another. For instance, cultural differences in communication styles might lead to misinterpretations of impulsivity or inattention. Furthermore, racial and ethnic biases, often unconscious, can influence how healthcare providers perceive and interpret behavioral symptoms. This can lead to underdiagnosis of ADHD in certain groups and overdiagnosis in others. Embracing cultural sensitivity in ADHD diagnosis requires a conscious effort to understand and appreciate the cultural context of the individual being evaluated. Utilizing culturally sensitive assessment tools, seeking consultation from cultural experts, and engaging with families and communities are important steps toward culturally competent care. Section 9. The Path Forward. Research and Understanding. Our understanding of ADHD has come a long way, but there is still much to learn. Continued research is essential for unraveling the complexities of ADHD, improving diagnostic accuracy, and developing more effective treatments. Investigating the interplay of genetic, environmental, and cultural factors in ADHD development is crucial for early identification and intervention strategies. Exploring the long-term impacts of ADHD across the lifespan, particularly in understudied populations, is vital for developing targeted interventions that address the unique needs of different age groups and cultural backgrounds. Research on the effectiveness of various treatment approaches, including medication, therapy, and lifestyle modifications, is crucial for tailoring interventions to individual needs and preferences. By fostering collaboration between researchers, clinicians, educators, and policymakers, we can create a more supportive and inclusive environment for individuals with ADHD, empowering them to thrive at every stage of life.